Hello, my name is Mark Ryan. I'm a fifth-year resident for general surgery at the University of Miami. Today I'm giving a talk about the use of antibiotics on farm animals and its effects on antibiotic resistance in humans. So if you go to the second slide, you'll see that I have a summary of basically how antibiotics are used in the farm animals. So normally you don't treat individual animals. So therapy is basically treatment of infection. So if they're showing signs of disease like respiratory stuff or diarrhea, other systemic symptoms, they can get antibiotics for that. If basically more cows are dying than normally, they can treat the entire group. Prophylaxis is basically if they're in a stressful environment, or if they're disease prone for whatever reason, like pigs, like when they're kept in close quarters. Metaphylaxis is basically animals are kind of treated as herds. So in a chicken coop, you don't normally treat a single chicken that's ill. You treat their group or their area. So you don't, or the entire section. And what it's normally used for in animals actually is not to prevent infection, but it's been found that it actually increases the rate of growth in these animals, irrespective of preventing infections. So that there's, if you look at the third slide, there's a couple different kinds of antibiotics that we use in these animals. So there's the penicillins, the cephalosporins, the sulfonamides. So you have penicillin, ceftriaxone, ceftazidime. Just basically, there's multiple kinds. Very few of them are actually used in humans, but there's significant overlap in terms of a mechanism. Now, moving on to the next slide, you can see that you can't really treat these animals as a single being. You treat the group because it hasn't been really shown to be effective. And animals can be prone to infection because they're the way due to farming practices in the United States, they're kept in close quarters, which increases animal stress. And they've tried to tune down the amount of antibiotics that they use in terms of treating infections, and it hasn't really worked that well. But I mean that has to do with it's tough to diagnose like a cough or a pneumonia or something in a cow because they don't routinely do X-rays and things like that for diagnosis. Okay, so the next slide shows you that kind of the history of how this came to be introduced into use for factory farms. They found that regardless of whether or not they show that chickens given tetracycline had significantly fewer or had significantly more growth, even though the amount of infections in the two groups weren't really different. So it didn't really matter whether you got an infection or not. The antibiotics made them grow all on its own, and they're not sure why that happens. It's just that maybe it's suppressing some disease, or maybe it's killing the native bacteria that you have in your guts anyway, and lets them digest this feed that they're given more efficiently. Also, like I mentioned, animals are kept in close quarters. They're under high stress. They're very prone to infection. So perhaps the antibiotics mitigate that effect somewhat. But I mean, there's 23 antibiotics that are primarily used that are given for animals, and only 8 of them are used for treatment. The rest are used only for growth. And believe it or not, 84% of all antibiotics used in the entire world for anything are used for agriculture. So for feed animals, and 70% of those are used just solely to promote animal growth. In people, the antibiotic use is a significant problem, and as are multi-drug resistant bacteria that you see in the hospitals. And over 100,000 people per year can die due to hospital-acquired infections. A lot of it's due to inappropriate antibiotic use in people, which is, you know, if somebody presents to the doctor and they're given a prescription for antibiotics when in fact they have a cold or they have the flu, and that makes it more likely that you'll get a resistant organism. Also, the problem with antibiotics is they're not very profitable, because you know, you make a cholesterol medication or a diabetes medication, the patient's going to take it for life, whereas if you give an antibiotic, they're going to take it for a week and they'll be cured and they don't need your antibiotic anymore. So the growth of new antibiotics has slowed down significantly, and so you have all these resistant organisms, the MRSA, the BRSA, which is methicillin-resistant Staphylococcus aureus, and vancomycin-resistant Staph aureus. ESBL means extended spectrum beta-lactamase. It just means that the bacteria is able to process additional antibiotics and get rid of them, basically. The United States has the NARMS, the antibiotic monitoring system, which monitors the emergence of these resistant bacteria. So on the next slide, what it's important to find out is these resistant strains that you can see in animals. So you can find resistant if you look in the area around a pig farm. You'll find resistant bacteria in like the waste that comes out of them and the area surrounding them. And they found similar strains of, for example, there's similar strains of resistant Campylobacter in pork and chickens and human. And you can always, and meat is occasionally found to contain antibiotic-resistant E. coli. Like as I mentioned, even though we're not getting the same antibiotics as the animals, since they're similar in class, the mechanisms the bacteria use to fight them off are similar, so they can become resistant to regular human antibiotics we use in the hospital. So, what the other question is, so people want to ban these because obviously it's a problem, the antibiotic resistance. But and if on the next slide you look in June of 2010, the FDA says that they want like Europe, they want to start using antibiotics just to assure animal health and not to promote growth. But I mean, the bans in Europe haven't really decreased the resistant antibiotics in people, so it's tricky to know if banning it would have any effect. However, but there is the animal productivity decreased in Europe following this ban. There were without any improvement in the welfare of the animals, and the resistant organism pool for Europe hasn't really changed all that much. So I mean, basically, what this question really requires is that you have to find, like if you were to design a trial for the Miami-Dade area, you would have to find strains of bacteria in areas that are animal producers for South Florida, and then you would have to compare these specific strains to the antibiogram for a county hospital. And every hospital is required to keep a antibiogram showing what kind of bugs these patients get in the hospital and what they're susceptible to, so that way you're giving the appropriate antibiotics. And so what you can do is compare these two things, compare the ones from the factory farms to the ones that are found in the food supply, and then compare them to the one found in people. And that hasn't been definitively done yet. And so you look at the final slide, basically the antibiotic use does breed resistant organisms, and it does decrease the efficiency of treatment in humans. But if you change this, if you just quit using the antibiotics in people, you're not guaranteed to improve the health of the livestock, but and you're not guaranteed to improve public health either. And but more likely the problem with our meat and with our factory farming practices is the livestock concentration, and that they're heavily concentrated animals, which places them at this additional burden and risk of infection, which would increase the use of antibiotics anyway. Now, I thank you for your attention. It's my first internet presentation, so I hope I did it right. Thank you.